costotransverse joint, right? So, Jess, if you just roll on your side for a second. Okay, so where you don't want to be is you don't want to be on the angle of the rib, because they will break, right? So you want to have a pretty decent idea of your anatomy. So here's spinous process, and then if I go 2 finger width away, like that is pretty uncomfortable. 1, because I'm pushing through muscle, and 2, because the costotransverse joints are just a bit sensitive to AP pressure. But I don't want to be out more lateral. Okay. When I come over, right? So if you flip back over, Jess, just for a second, and if we set her up properly with a towel or blanket, with our T-spine techniques, the predominant difference between this and the rib is the fact that I'm rolling her flat with the T-spine, right? With the rib, I'm rolling her about 45 degrees away from me, such that because my hand is going to be more lateral than the spinous process is going to be on that costotransverse. So instead of the spinous process being here, right, I'm actually going to have have it a little bit. The spinous process is going to be over here, and you can do so by using this grip, right, where I'm trying to get the far side of the costotransverse, and then I'm going to need to roll her over further than I otherwise would to be able to get that the joint in question well lateral to where I was previously on the facet joint or the articular column. Because I'm rolling her over, my vector of force doesn't change. I'm still going straight down because I'm already over that joint and it's already perpendicular. It's not comfortable, as I mentioned just a moment ago, even when we were like poking and assessing briefly, that to have pressure on the costotransverse. So if you want to hang out and have them do their breathing, fine, but don't do it when they're flat, and then roll them over and then hit the rib at the 45. But don't have them breathe while you're on the 45 because they'll tighten up and it can just leave them sore. Okay, so that being said, Jess, I'm gonna have you come all the way towards me. This can be, it can be a little bit challenging if depending on like arm length as well as the relative size of the person to the provider. You may need to, again, bolster yourself on a small step, or there's other techniques where you can come from the proximal side and roll them 45 degrees to you if you really can't get around them. Okay. All right, and then foot placement, we'd have it just like that. All right, so transverse, costotransverse. And so I'm going to come in like this. And then add a little bit of side bend, come up over 45 degrees. And it's gonna be a little bit different of a clunk. It's gonna be a little bit, I don't know, a little bit lower of a vibration audibly, right? Versus it's like click, 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 click for the T-spine, but there's a, yeah, it's just got like a different feel to it. I felt like that was pretty lateral. Yeah. All right.